So balloon sinuplasty is a procedure whereby a very small balloon is passed through the nasal cavity into the blocked opening of a sinus and is then used to inflate the balloon and open up the blockage, allowing that sinus to drain properly. So we start by freezing the nose with a topical freezing spray, and then we use a small needle, kind of like the dentist would use. And after that, when the patient is really well frozen, we can use the small probe with the balloon on it to find the opening of the sinus, and then we use a little bit of a syringe type mechanism with fluid in it, which will inflate the balloon, and we'll hold it there for a few minutes to allow that opening to stay open after we deflate the balloon and take it out. No. Unlike traditional sinus surgery, there's actually no tissue that is removed. We only find the natural opening and stretch it open with the balloon. So it's important to realize that balloon sinuplasty is not a replacement for traditional endoscopic sinus surgery for conditions like generalized chronic sinusitis or nasal polyposis. But rather, it's useful when you have one or maybe two blocked sinuses where the problem is really localized, maybe because of a scar or because of very narrow anatomy. That's when it's most useful. So the procedure usually takes around half an hour, give or take. And it can be done without general anesthesia, and that's really what's fantastic about it. Patients can come in, we can freeze them, and right in the examining chair, we can use the balloon to find the blockage and open it up. And usually it will result in an improvement in symptoms without the need for general anesthesia. This also means that the recovery time is a lot quicker and patients can usually go back to work the next day. Usually patients will report immediate relief of their symptoms, and as long as the sinus remains open, the results are long-lasting. So, the common things are to have a little bit of discomfort during the dilation procedure, and there can also be a mild nosebleed that can result. Very rare complications. So in select patients where they have one or two blocked sinuses, I think this is an excellent option, which is really minimally invasive and does not require general anesthesia and can be done quickly and relatively comfortably, and is very effective without a long recovery period, so patients can get back to their regular activities very quickly.